Why is echogenicity important when interpreting your kidney ultrasound? Imagine looking at an ultrasound image of your kidney and noticing how bright or dark it appears. That brightness is called echogenicity, and it tells doctors a lot about what's happening inside your kidney. Echogenicity refers to how much sound waves bounce back from the kidney tissue during the ultrasound scan. The more sound waves reflected, the brighter the image appears. This brightness helps doctors assess the health of your kidney tissue. In a typical kidney ultrasound, the outer part of the kidney, called the cortex, is usually less bright than the liver, which acts as a natural reference point. When the kidney cortex looks brighter than the liver, it can be a sign that something is changing in the kidney tissue. Increased echogenicity may suggest inflammation, scarring, or fibrosis, which are common in many kidney conditions. It can also be linked to chronic kidney disease or other kidney problems. However, it's important to remember that increased brightness alone doesn't always mean disease. Some healthy people can have kidneys that look brighter than usual, especially if their liver is affected by fatty liver or other conditions. Doctors also look for the difference between the cortex and the inner part of the kidney called the medulla. Normally, these parts have different echogenicities, so if that difference is lost, it could indicate more serious issues like infection, rejection after a transplant, or blood vessel problems. But interpreting echogenicity isn't just about brightness. It can also be influenced by how the ultrasound is performed, the settings on the machine, how hydrated you are, and even the health of your liver. For example, a fatty liver can make the liver appear brighter, which might affect how your kidney's echogenicity compares. In children and fetuses, echogenic kidneys can sometimes be a sign of various kidney disorders, but further tests are usually needed to understand what's going on. When it comes to kidney cancer or other serious conditions, increased echogenicity can serve as a warning sign that prompts additional testing. It doesn't diagnose cancer by itself, but helps guide the next steps, like more detailed imaging or a biopsy. Overall, echogenicity is a valuable piece of the puzzle in kidney ultrasound interpretation. It provides clues about tissue health but must be considered alongside other findings and your overall health. Proper interpretation helps doctors decide whether further tests are needed and how to best care for your kidney health. Remember, always discuss your ultrasound results with a healthcare professional who can interpret them in the context of your unique situation and guide you toward the right diagnosis and treatment.